menstruation, menstruation. During menstruation, during menstruation. Abdominal, abdominal pain. During menstruation. Have abdominal pain during menstruation. I'm having menstruation. I'm having menstruation. A period, a period. I'm having a period. Menstrual, a menstrual period. I'm having a menstrual period. Cycle, menstrual, menstrual cycle. My menstrual cycle is 38 days. My menstrual cycle is 38 days. 28 days. Regular, regular. Is your menstruation regular? Is your menstruation regular? Have regular menstruation. Do you have regular menstruation? Do you have regular menstruation? A regular period. A regular period. Do you have a regular period? Do you have a regular period? The first day. The first day of your last period. The first day of your last period. When was the first day? When was the first day of your last period? When was the first day of your last period? When was the first day of your last menstruation? My period is late. My period is late. More than 10 days late. More than 10 days late. Over 10 days late. My period is more than 10 days late. Period. How late is your period? How late is your period? You last have a period. When did you last? When did you last have a period? When did you last have a period? I last had I last had a period 8 months ago. I last had a period 8 months ago. Before and after your period. Before and after your period. Wait until. Wait until. Completely stops. Completely stops. Wait until your period completely stops. You completely stop having a period. Stop having a period. Wait until you completely stop having a period. Wait until you completely stop having a period. Come back for the examination. Come back for the examination. When you completely stop having a period, come back for the examination. When you completely stop having a period, come back for the examination. Often last. Often last. How long does your period often last? How long does your period often last? Last for about 4 or 5 days. Lasts for about 4 or 5 days. It often lasts for about 4 or 5 days. Can you tell me how long you haven't had a period? You haven't had a period. Can you tell me how long you haven't had a period? Can you tell me how long you haven't had menstruation? Vagina, vagina. Vaginal, vaginal. Vaginal bleeding. Have vaginal bleeding. Discharge, discharge. Vaginal discharge. Describe. Can you describe? Can you describe your vaginal discharge? Can you describe your vaginal discharge? Delivery. Vaginal delivery. Have vaginal delivery. Cesarean. Cesarean section. Have cesarean section. Did she have vaginal delivery or cesarean section? Did she have vaginal delivery or cesarean section? Did she have vaginal delivery or cesarean section? Device, device. Intrauterine, intrauterine, intrauterine device. Use intrauterine device. I was advised to use intrauterine device. I was advised to use intrauterine device. Pills, contraceptive, contraceptive pills. I've been taking contraceptive pills for years. I've been taking contraceptive pills for years. I've been taking contraceptive pills for years. Sterile, sterile, sterile. Infertile, infertile, infertile. She's sterile, she's sterile, she's sterile. She's infertile, she's infertile. Infertility, infertility, infertility. Treatment, infertility treatment. Have infertility treatment. Is costly, costly. It's costly to have infertility treatment. It's costly to have infertility treatment. Sperm, sperm count, count. Have a low sperm count. Have a low sperm count. He is infertile because he has a low sperm count. He is infertile because he has a low sperm count. Cord, cord, umbilical cord, umbilical, umbilical cord. Wrap, wrap, wraps around the baby's neck, the baby's neck. The umbilical cord, the umbilical cord wraps around the baby's neck. The umbilical cord wraps around the baby's neck. The umbilical cord wraps around the baby's neck. Inflamed, inflamed. Inflammation, inflammation, inflammation. Your vagina is inflamed. Your vagina is inflamed. Inflamed vagina. Have inflamed vagina. You have inflamed vagina. Vaginal inflammation. Vaginal inflammation. You have vaginal inflammation. You have vaginal inflammation. Your vagina is inflamed. You have inflamed vagina. Infected, infected. Infection, infection. Your vagina is infected. Is infected. Your vagina is infected. You have infected vagina. You have infected vagina. Vaginal infection. Have vaginal infection. You have vaginal infection. Cervix, cervix. Dilate, dilate. The cervix is dilating, is dilating, dilating. The cervix is dilating. 5 centimeters. The cervix has dilated to 5 centimeters. The cervix has dilated to 5 centimeters. At birth, at birth. Weighs, weighs. 3.1 kilos, 3.1 kilos. Weight 3.1 kilos at birth. The baby weighs 3.1 kilos at birth. Birth weight, low birth weight, low birth weight. The baby is low birth weight. The baby is low birth weight. Under 2.5 kilos. Under 2.5 kilos is considered low birth weight. Under 2.5 kilos is considered low birth weight. Side effect, side effect. The side effects of this drug. The side effects of this drug. The side effects of this drug. What are the side effects of this drug? This medicine is good, but it has some side effects.